Well, you know, it's been almost a year since schools, businesses, and even playgrounds shut down because of the coronavirus.
Yeah, and for toddlers and younger children, that's more than half of their lives in quarantine. So what is it doing to their development? Joining us now is child psychiatrist Dr. Mitali Wadekar with Dignity Health Northridge. Doctor, thank you for joining us.
You're quite welcome.
We wanted to start with what types of developmental problems you're seeing right now in younger children.
There's so much uncertainty these days, whether the children are going to be able to go back to school and when, or is it going to shut down again? Lack of social interaction with peers, which is, one of the most important things, even more so than academics, that is really affecting these younger children, even older children. They're stuck at home. There's just a huge disruption in their daily routine and schedule, so a combination of anxiety, just sort of having that uncertainty is really hard on children.
Many kids are only interacting with their families right now. So what impact is this having on their social skills? And secondly, is there such thing as too much family time, especially for younger children?
Yeah, family time is very important. It is the most important for younger children, but social interaction is probably the second most important, reason kids should be going to, schools, having play dates, which we do, if there was no COVID situation. But right now they're stuck at home. There's this lack of social interaction. There's so much kids learn through social communication, sharing, taking turns, all those things, so it's really taking a big toll. Family is great, and being supportive, being with them through this time is important, but the lack of friendships, the lack of social interaction is taking a toll, unfortunately.
What can parents do about this? Because so many people are still uncomfortable about mixing with other families, and they're playing it safe. They're respecting, the boundaries that this pandemic has made us all grow far too used to. But what advice do you have for parents whose children really are struggling with this lack of getting together with peers?
Right. So the one thing I explain to parents of little children is that social distancing doesn't mean social isolation. There are ways you can interact with your peers through Zoom or various other platforms, having regular FaceTime connection with your friends, other family members, relatives, cousins, just to keep children talking and interacting with others. Using masks, staying safe is important. Having a regular daily routine, which is hard, if you're stuck at home trying to also work and care for the kids, it's hard, but maybe making visual schedules so that kids can have some predictability in their very unpredictable life right now. So I recommend that, staying calm and positive, encouraging, flexibility, just explaining and being honest to the kids about what's going on and that we don't know what tomorrow might bring. But also sort of, being a listening board for their anger, their anxiety, their frustration, just being calm and being supportive is important.
What are some of the long-term effects that children will endure because of this pandemic? To be honest, we don't really know how it's going to affect the kids long term, but this lack of social interaction, it's been almost a year now and going on, is going to take a toll. It's going to be an adjustment. It's going to be hard, but believe it or not, children are very resilient, and a lot of the kids, will catch up academically, socially, once things get back to normal, whenever that is. So I just like to ease parents' anxiety about that. Kids are very resilient and they will adjust, they will adapt. We just need to be the strong force behind them, the strong support that they need, so that there are not that many long-term problems. Yeah, it can be a struggle sometimes, let me tell you. Dr. Wadekar, we appreciate your time here this afternoon.
Absolutely. You're welcome. Thank you.
All right.